Based on 2001 Bethesda system, the specimen adequacy categorized into satisfactory and unsatisfactory only, where it eliminates borderline category from back in 1991. Satisfactory specimen adequacy is described as presence or absence of endocervical or transformation zone (TZ) component and any other quality indicators such as partially obscuring blood, inflammation, and other as appropriate be included in the report. Any specimen with abnormal cells such as ascus, AGC, or worse is satisfactory for evaluation.
So, what is the criteria of satisfactory smear? First, it must be properly labeled smear. Second, clinically relevant information. Third, appropriately fixed smear and adequate squamous component. Adequate squamous component is defined as a minimum estimate number of well-preserved and well-visualized squamous cells. When the sample cell is less than 5,000 cells, it may lead to chemo, radiation therapy, post-menopause, or post-hysterectomy, and the specimen is still considered adequate. But it considered inadequate when technical problems occur in slide preparation, such as bloody specimen that cause scanty cellularity. When sample less than 2,000 cells, patient history must be considered. For specimens that meet minimal criteria for satisfactory cellularity but have only 5,000 cells to 20,000 cells, should be common, borderline, or low squamous cellularity.
The presence or absence of endocervical or transformation zone component in the sample is reported as satisfactory for evaluation, and it is important to describe its presence or absence. For the endocervical component to be considered as present, it requires at least 10 well-preserved endocervical cells. The presence or absence of a transformation zone component should be reported and is not associated with increased detection rates of squamous lesions. When 50 to 75% of the epithelial cells cannot be visualized, a specimen is considered partially obscured and should be termed satisfactory, and obscuring information should be mentioned. Also, report comments such as a-drying of possible atypical cells or severe acute inflammation can be added when particular cells or areas of diagnostic interest are obscured.
Lubricant. Avoid using lubricant containing carbomers for collecting liquid-based PET tests because it reduces satisfactory specimen adequacy. Lubricants that exclude carbomer have no observable effect on specimen adequacy. Possible to reprocess specimens with lubricants using a modified show-path preparation procedure, but low rate of success. Excessive blood. If 50 and to 75% of cells are obscured, specimen reported as partially obscured have to follow the satisfactory term, which is the quality indicator. Laboratorians need to estimate the minimum numbers of well-visualized squamous cells present by referring to the criteria for satisfactory specimen adequacy. Adequacy is determined by two judgments. First, the cytologic finding in the report are comparable with the clinical findings. Lesion was adequately sampled based on the expert's opinion. The slides are not distorted and can be interpreted based on the pathologist's opinion.
Specimen adequacy will be reported in the discrete section of the report based on this PET smear worksheet format. So, how to report the PET smear based on the worksheet? This is a sample of pap smear. So for this picture, shows NIM benign cellular changes associated with irradiation. To report, firstly, tick on Satisfactory for evaluation and endocervical cells or TZ cells absent in the form. Next, at interpretation section, tick on NILM and choose benign cellular changes associated with irradiation. And lastly, tick on repeat smear as scheduled at suggestion section.